This video is for people who are suffering with troublesome hamstring pain at the bottom of their leg towards the back of the knee here, where the tendon is involved. This can be quite troublesome for people. It can't be treated the same way as an ordinary hamstring muscle injury. My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Dublin in Ireland, and we are going to go through 5 exercises here that you need to help yourself get back on the pitch playing your sport. Now, as well as those exercises, we're going to go through how you fit this in your week, because it's not just about these exercises. Your entire sort of training load and your dosage and how you fit this in and how you manage your running is all part of returning to play here. A lot of people who suffer with this will have tried and failed several attempts at rehab and at returning to play, and they maybe do for a while, but it comes back at them and it becomes very, very frustrating for people. Then there's a lot of unnecessary treatments and investigations, and it can become more of a problem than it needs to be. Some of the things we're going to talk about here are the amount of this work that you need to do. So not just the exercises. I'm not even going to go through lots of exact repetitions. With these exercises that we do, you go until you feel the area that we mention really burned and really fatigued. So just before we get into the exercises, with this injury, the order in which you do the exercises can be very important. So if you go in and, for example, one of your first exercises is something where you have your heel up on a bench and you're doing a traditional hamstring bridge and you make your tendon here sore, that can prevent you from doing a lot of work in the gym. So the order can be very important in this one, and in the exercises that we go through right now, we're going to start from the hip and glute area and work down towards the belly of the hamstring. Then we're going to go from the calf area, and then we're going to work, once it's nice and warm and fatigued, then we will work into the back of the knee and localized on the tendon itself. A lot of these injuries are underdosed. They don't get enough. People don't do enough. Therapists aren't sure of how much you need to do. For the most part, you need to do a lot more than you think to return to the demands of your sport. Let's get straight into the exercises. So the purpose of exercise number 1 is to get muscle activity in around the hips and glutes. I'm going to do 2 examples here. For this one, start with your feet about shoulder width apart, and just go squatting up and down with outward intent into the band. So you're pushing your knees out into the band. After about 10 of those, stay down there in this position and start pushing your knees in and out as far as you can. What you'll do, say 10 of those, and then you'll repeat. Go back to 10 squats, 10 rotations. What should happen is you start to feel muscle activity here. Go till you feel it's really burnt up and you can't do any more. The second option for this, which you could include with it, is similar activity, but lying on your back. Push the knees out into the band and bridge up for 10. And then after 10 reps, stay up there, in and out like that, and you'll fairly quickly feel a big burn in around here, and just repeat until you feel you can't do many more there. The next thing we're going to try and do is, again, work this area here. So you should be feeling it up here in this position. So you'll go straight into it from the band exercises. So here, and just push up, hold it for a few seconds, try to actively squeeze this and take a break. Pushing your heel through the ground, squeezing here, you should feel here, and maybe it's creeping a little bit into the hamstring, which is also fine. You might do 10 or 12 repetitions of that. Then we're going to move from that to trying to focus on getting the belly of the hamstring a little bit more. So after you do, say, 10 or 12 reps, what you'll do then is bring your heel a little bit further out. It's not enough to annoy this area here. We're trying to feel it here. And just go into a more hamstring focused exercise. Again, focusing through the heel, pushing down for about 5 seconds and back down. And as I'm doing this, as you repeatedly do it, you will feel this area here working. So the first few exercises have brought the work from here all the way down to the belly of the hamstring, and you're doing a decent bit of fatigue with that. So the next exercise we're going to do is to work the calf. We've started here, come down to here, now we're going to work the calf. So again, get the ball of your foot on it, stay nice and tall, focus on pushing through the ball of the big toe and the toe beside it. Hold it up there at the top for 1 or 2 seconds and just go with that tempo all the way up, all the way down. As you go, you should feel the calf working hard, Stop with about 2 repetitions in reserve. We're going to move on to an exercise now where you're working more targeted in at that area. But remember, at this stage, you've done all the previous exercises and you've worked your glute, belly of the hamstring and calf, and they feel quite fatigued and they're nice and warm at that stage. Now we're moving into this one to get the posterior knee, bottom of the hamstring. It's a little bit more technical, so just take a look at the video. So lying on your back, come up about 1.5 feet. So that would be about there. Now, lift your hips up just so your fist can get in underneath your tailbone. That's high enough. Bring this other knee up here. Relax your upper body. Now with the ball of my foot, I'm pushing into the wall slightly and I'm slightly dragging it down the way with a little bit of downward intent. The purpose of this exercise again is that you do feel it here. Even if it's slightly uncomfortable, that's fine. So in this position here, pushing in and down, stay nice and relaxed. You should feel your entire hamstring working quite hard. And in terms of how long you're going to do there, it depends on what level you're at. It certainly wants to be equally as competent as the other side. So you could time yourself on the other side. Generally for return to play, you want to be getting up to about 45 seconds of a hold. You might start with 20 or 30 seconds depending on where you're at. You'll do 2 repetitions in a set. So the next exercise, you might not be able for it right now, but you certainly need to be able to do this to return to play and return to running. So this might be one you leave out initially, but if you can do it, you need to move on to it. So similar setup as the last one, but what you're going to do is so you can see there, I'm tapping the ball of my foot against the wall and trying to keep my body in place. It adds a little bit of extra stress to that area and mimics the demands on that area when you're going to be running. You try and do maybe 15 in a set. Okay, so this lunge pattern exercise is going to have a high enough demand of this area here. And when you get back to your sport, it's probably going to involve you accelerate and decelerate and working in different directions. So we're trying to mimic that. The important thing in this exercise is that you have all the intent through your front foot. So I'll give you an example here. So I'm really pushing back with intent through my front leg. Both dumbbells, they're light enough. They come down close to your knee and push back up. So it's not a full distance lunge. After I do about 10 of those, step to the side, and again, dropping both dumbbells beside your knee, and you can see there's clear intent with my left foot as I push myself off the ground there. So you might do 10 and 10, so 20 in a set. Okay, to get this better, you also need to run. There are certain demands that rehab can't replicate. As long as it's at the appropriate intensity, that's fine, and it's important to do that. So let's look at sample running that you can do alongside this injury that you need to do. So here I've something laid out, 20 meters, 50 meters, 70 meters. So you build up here. You maintain the pace for this 30 meters all the way through the line. You decelerate, turn around straight away, build up, maintain the pace, decelerate. So up is 1, down is 2, 3, 4, 5, 6. 6 runs is 1 set. Rest for a minute or whatever you need to rest for. And you might do 5 sets of that. So it's 30 of these runs. Now what's key is the pace. Let's say you're going to start off with a pace that you can cope with. Let's put it at, say, 60%. So this is the area where you'll be doing your 60%. If you feel fine with that for 2 sessions, so fine during it and fine afterwards, then that indicates to you that you can move up in the pace. You don't necessarily move up every single session. Try and get 2 sessions done at 60% before you would turn that into 70% here. Once you get 2 sessions at 70% where you feel okay, move it up to 80%. 2 sessions of that, move it up to 90%. You might have to stay there a little bit longer, do some runs at 90, some runs at 80. You're trying to build, gradually expose it to higher paces. Having a very slight awareness is okay, but you shouldn't be suffering afterwards the next day. That's not, should you feel anything at all. You might feel a little bit, but by lunchtime the next stage, it should be cleared, pretty much cleared. They would be our guidelines. Now, once you get to 5 sets of this at 100% pace, that puts you in a position to get back into your team sport. There you're going to be taking part in different drills and reactive stuff that you also need to be able to do. But generally, you'll have enough capacity at that stage to cope with those things. And remember, even when you return to play, you're also going to be doing some of your rehab before you go onto the pitch. That's a step that people leave out. They feel better and then they stop doing it. So that can't happen with this. So now, how do you fit all of this in? So my recommendations on this would be, if you think of a typical week for your own training. So say on day 1, you're going to do your running, but you never run without doing 2 sets of the rehab. So the 5 exercises that I've given you, you might do 2 rounds of that, so it's nice and warm. You go and get your running done. On day 2, it's just all rehab. So you might do 3, 4, 5 sets of those exercises to really fatigue and work that area. Day 3 is a rest day, and day 4, you're back to running again. You repeat that cycle. Running with the rehab beforehand. The following day, it's your heavy rehab day, and then it's a rest day. So that's getting a good balance between working the area really well, but not being so fatigued you can't go and run. And if you are too fatigued, you need to take an extra day. Depends on your conditioning and things like that. But that's how I would schedule out the week. And then, so you're running 2 or 3 times over, 6, 7 days. And as the days, how long it's going to take you, depends on, you need to get up to 100% pace with this stuff here. Now, in terms of your other training, gym training that your coach might be giving you, squats, deadlifts, whatever it is, you can do all those fine. As you probably know yourself, they're not fixing this. They're not going to aggravate it, but it's not enough to fix it. So it's good to do those in your general strength work, but this is the stuff you need to add in to your training to really load that area up. Tendons need load more than you would think, and that would be my advice for this. So if you have any questions, if this is troubling you, feel free to reach out and message us or comment below, and we'll get back to you that way. Thanks.